It's about to get dark. Dark circles, that is. You see what I did there? I made a joke. Dark circles are no joke. It has to be one of the most commonly sought after pieces of information with regards to skincare. How to get rid of dark circles. What's a good eye cream for dark circles? Best concealer for camouflaging dark circles. If you have dark circles, this is the video you need to be watching, because the information I'm going to give you today is going to change the game for you as far as how you spend your time, your money, your efforts on your dark circles. Dark circles can be sort of an ill-defined entity. They go by many different names: periocular hyperpigmentation, periorbital melanosis, infraorbital darkening, infraorbital discoloration. So many names, yet still the underlying reasons remain elusive. But don't worry, I'm going to make it very simple. When approaching dark circles, there are actually three main categories. Pigmented dark circles tend to be brownish. Vascular dark circles take on more of a purple, violet, deep dark brown hue. And then there's structural, which can lean more towards a skin-colored dark circle. Guess what? These three types, there can be overlap, meaning you can have vascular and structural components to your dark circles. There are a few little tricks, some of which you might even try on yourself, to help distinguish what type of dark circle you have. To differentiate dark circles related to discoloration of the skin versus dark circles due to shadowing from prominent tear troughs, you can just stretch the skin. If it's actual pigment, it will remain unchanged. But if it's due to shadowing from a prominent under eye hollow, well, that dark discoloration will improve or completely go away when you stretch the skin. If it's related to prominent blood vessels and or thinning of the overlying skin, making those blood vessels more obvious, when you stretch the skin, the pink-violet discoloration will actually intensify, because as you stretch, you are essentially thinning the skin temporarily by those stretch forces. If your dark circles are related to pigment, the question becomes, where in the skin is that pigment? Is it in the epidermis or is it in the dermis? We can utilize a tool known as a Wood's lamp to help distinguish the two. Pigment that is in the epidermis will be more obvious under a Wood's lamp, whereas pigment that is down in the dermis will become less well defined under a Wood's lamp. We can also utilize ultrasound to help determine if there is a vascular component driving the dark circles. Being aware of the different causes of dark circles is really what is going to empower you to stop wasting your time chasing after different dark circle creams and correctors that probably won't do anything for you. Now, that being said, there are a handful of ingredients in skincare products for the eyes that can improve the appearance of some types of dark under eye circles, but not all. You've heard of hereditary dark circles. These are dark circles that you probably are destined to develop because of your family history, your genetics. Maybe it's just the way that your eye is shaped as it relates to your genetic makeup. Genetic or hereditary dark circles, they tend to first appear in childhood, adolescence. You will have a family history of dark circles. Multiple family members will have dark circles of varying intensities. Hereditary dark circles tend to become more prominent with age. Families who have dark circles tend to report that the dark circles become more apparent during periods of their life where their health is poor, they're really stressed out, or they haven't been sleeping well. And then they tend to improve when their health improves. They get better sleep, maybe they go on vacation, they're more relaxed. Hence that common tip, oh, I have dark circles, I must be sleep deprived. This observation with regards to hereditary dark circles is probably why, if you have dark circles, someone has told you you look tired. But listen, not all types of dark circles have anything to do with your sleep. The other type of dark circle relates to dermal melanocytosis. Dermal melanocytosis means that there is pigment down in the dermis. There are melanocytes down there where they're not supposed to be. This is essentially kind of a type of birthmark. It's called a nevus of Oda. Usually only affects one eye, although in some cases it can affect both eyes. Because the melanocytes laden with pigment are down in the dermis, it gives a very characteristic appearance in that it tends to be this sort of bluish gray discoloration. You can have little circular round spots come together into large patches. Importantly, if you have this type of discoloration around the eyes, this can extend to your eye, to the whites of your eye, and if you open your mouth, you might see hyperpigmentation on that side of the roof of your mouth. It also can involve your eardrum, even the mucosal surfaces inside your nose. Nevus of Oda is something that you're born with. It's a type of birthmark. If you have it, let me save you time and energy. Stop trying to buy creams that will get rid of it. No cream, no ingredient that you apply to the skin skin will get rid of a nevus of oda. Hydroquinone does not address this. Nothing that you apply to the skin will get rid of it. The only thing that you could apply to the skin that might improve the appearance of it is a makeup, whether it be concealer, foundation, to provide cosmetic camouflage. But nothing is going to take it away. There are certain laser treatments that can target the melanocytes down in the dermis and improve the appearance of this. As you can imagine, this is met with varying levels of success. Another type of dermal melanocytosis around the eyes, however, is acquired, and it typically happens to both eyes, in contrast to nevus of oda, which usually is just one, although of course there are exceptions. But this acquired form of dermal melanocytosis around the eyes is horis nevus. Horis nevus is bilateral, both eyes. It is acquired. It may be precipitated by changes in hormones, sun exposure. In contrast to nevus of oda, there is no mucosal involvement. It's not going to involve the roof of your mouth or the inside of your nose. If you have either of these conditions, nevus of oda, which is congenital, or horis nevus, which is acquired, save your money. There is not an eye cream, a topical medication that will get rid of this. The melanocytes are down in the dermis. No cream is going to access them to suppress their pigment production. So you can't get rid of this with a cream, period, point blank. Now, there are certain laser-based treatments that can target those melanocytes down in the dermis to improve the appearance, but as you can imagine, this is met with varying levels of success. You also could use makeup to camouflage this if it really bothers you. All right, the other entity is post-inflammatory hyperpigmentation. This you can be a little bit optimistic about in that you don't necessarily need to buy anything and it might go away. So post-inflammatory hyperpigmentation is just as it sounds, hyperpigmentation left behind after an inflammatory process around the eyes. Most commonly, that's going to be either atopic dermatitis or a contact dermatitis. Maybe you used a skincare product around your eyes that was very irritating and your skin healed with discoloration. Post-inflammatory hyperpigmentation is a lot more common in people who have a deeper skin tone. It doesn't tend to affect paler skin types. You can also get post-inflammatory hyperpigmentation when your allergies are really bad and you rub your eyes chronically. That rubbing, that friction on the skin can lead to post-inflammatory hyperpigmentation. The key to getting rid of this is controlling the underlying causative issue, whether it be atopic dermatitis or contact dermatitis, in which case you'd have to avoid the offending contactant, or just trying to control your allergies so you don't rub your eyes. Sun protection is also key, as sun will worsen this type of hyperpigmentation, make it more stubborn to fade. Bland moisturizers can be helpful, provided you're not allergic to anything in the formula. Topical hydroquinone can help this resolve faster, but can be pretty irritating, so it's a delicate balance. If that hydroquinone is irritating, guess what? Causes post-inflammatory hyperpigmentation. So it's a delicate balance between, being conservative or trying things to hasten the clearance, but those things in the long run might end up being too irritating. Number 4, superficial vasculature. Vasculature meaning blood vessel, superficial meaning very close to the skin surface. The skin around our eyes is very thin to begin with. It's very delicate. It thins with age. Some people, their blood vessels are even closer to the skin surface, and so under the eye area, it just is a lot more obvious. You have discoloration basically as it relates to the blood vessels under the eyes being so close. This tends to be sort of a violet color and is a lot more prominent in the inner corner of your eye. Many women note that this seems to intensify with the menstrual cycle, with menstruation. If you have this type of dark circle, when you stretch the affected skin, the violet color will intensify. It will not fade, it will not blanch. Long-term use of a topical retinoid around the eye may help to improve collagen, thicken the skin a bit, and lessen the appearance of these. There are also a variety of cosmetic procedures aimed at collagen induction that, when done to this area, may help to lessen the appearance of vascular dark circles. For the most part, eye creams, not really going to make a difference here. The exception being perhaps caffeine. Caffeine may help to temporarily constrict the little blood vessels under the eyes and temporarily lessen the appearance of these dark circles. The next one is tear trough depression. Depression of this area of the eye becomes more common with age, and it relates to just changes in the bony structure around the eyes. We get bone resorption coupled with thinning of the skin, along with descent of the cheek, stretching that area. The hollowness under the eye related to bone resorption coupled with a pseudo herniation of fat around the area really can make dark circles quite apparent here. These types of dark circles are a lot more obvious in certain lighting, and this is another case where creams, lotions, active ingredients applied to the skin are not going to do anything. This is a case where there are going to be cosmetic interventions that can improve the appearance of prominent under eye hollows. Filler, of course, is one you've probably heard people talk about for or tear trough deformity. However, it does come with a high risk of complications. And there's also blepharoplasty. Next is periorbital edema. Basically, you have accumulation of fluid under the eyes. This is the kind of dark circle that is more obvious in the morning or after eating a salty meal. This is a kind of dark circle that improves with cool compresses and or the use of a caffeine-containing gel. Through vasoconstriction helps to push that fluid from the under eye skin and improve the dark discoloration. This type of under eye darkening can be accompanied by puffiness. Sleeping with your head slightly elevated, avoiding high salt meals can help control the puffiness, reduce accumulation of fluid under that area, and also help to brighten up the under eye. Periorbital edema and prominent dark circles can also be aggravated and or brought out by having allergic rhinitis, hay fever, seasonal allergies. This is referred to as allergic shiners as it relates to accumulation of fluid, swelling, and leakage of blood out throughout the surrounding skin under the eyes from that chronic fluid accumulation. Controlling the allergies is key for improving these. An eye cream, however, is not the answer. Here's another cause for which eye creams do jack squat: pigmentary demarcation lines. Pigmentary demarcation lines are honestly one of those entities that makes you unique, and I really think people should embrace, but that's my opinion, which you didn't ask for. So pigmentary demarcation lines are exactly what they sound like. These very distinct borders of deeper pigmentation next to lighter pigmentation. Often they will appear on the backs of the legs, the inner thighs. They can happen on the face, and they can happen around the eyes. This is congenital. It tends to be more obvious in people who have a deeper skin tone. Pigmentary demarcation lines likely reflect how we are formed as embryos and how the cells in our skin migrate to the skin from their origin. In some cases, they may just kind of be a little bit lateralizing in certain areas, and you get these prominent lines. No cream is going to get rid of these. They are just how you're made up. There's really nothing to treat these. Basically, how you were formed. A cause of discoloration around the eyes, definitely worth mentioning, are prostaglandin analogs. Bimatoprost, latanoprost. These are medications that could be introduced into the eye for the treatment of glaucoma. However, these treatments are also used for lash growth. And a side effect is hyperpigmentation, periorbital hyperpigmentation. Fortunately, this type of hyperpigmentation typically resolves within about 3 to 6 months of stopping the prostaglandin analog. It's not permanent. It's just a negative temporary side effect of using these. But so long as you continue to use them, you will continue to have hyperpigmentation around the eyes. So those are some of the main underlying causes for why someone might have dark circles. But as you can imagine, if you're born with hereditary dark circles, you have seasonal allergies, and maybe you have atopic dermatitis, because a lot of people with seasonal allergies also have atopic dermatitis. So you go through life with a background of dark circles due to your genetics, then that gets aggravated by fluid accumulation with seasonal allergies, allergic rhinitis, plus you get flares of eczema around your eyes, you rub your eyes, all of those things can lead to kind of multiple factors driving the dark circles. So addressing each of these components together is really necessary to get better control of the dark circles. All of these causes aside, there are certain environmental factors that are thought to play a role in worsening of the appearance of dark circles, although the data behind this is kind of weak. It's mostly just, what's been passed down from person to person who deals with dark circles. Like I said at the beginning of the video, a lot of people feel as though a night of poor sleep, they will wake up and their dark circles are a lot more obvious, hence the you look tired. Smoking, excessive alcohol consumption are also thought to worsen the appearance of dark circles. And for whatever reason, they tend to be more obvious when we're stressed out. Maybe that feeds into a night of poor sleep. I'm a big advocate of self-care, minimizing unnecessary stress, getting good sleep, but I'm not going to pretend that getting a good night's sleep alone, not smoking, not drinking alcohol in excess, and managing your stress are going to be enough to get rid of some of these different types of dark circles that we have talked about in today's video. All right, guys, so that's a wrap up with regards to dark circles. I hope this video was informative to you guys and helps you better understand why you might have dark circles. Maybe you can try the stretch test on yourself to determine if you maybe have some shadowing or a vascular component versus true hyperpigmentation. All right, y'all, if you enjoyed this video, give it a thumbs up, share it with your friends, and as always, don't forget, sunscreen and subscribe. I'll talk to you guys tomorrow. Bye.